Greetings, everybody. Welcome to Shura TV and the Genesis Medical Center show. My name is Dr. Azar. I'm here to chat a little about different subjects that are in the news, specifically medical subjects that are in the news and on people's minds. Of course, today's March 11th, 2020, and we're here in the midst of a officially declared pandemic, meaning that the COVID-19 virus is officially labeled a pandemic by the World Health Organization. And today we wanted to discuss a little about things, how you can protect yourself, as well as people who have heart disease or heart issues, and those people, what they have to do, and specifically why elderly clients or patients need to protect themselves if they do have heart disease. We'll get into the latest facts and figures on the coronavirus and the COVID-19, and then after that we'll spend a little time discussing heart disease and why it's so rampant here and some of the risk factors and what we can do to protect ourselves from it, and specifically from getting the COVID-19 while having heart disease as well. And if you yourself know anybody, specifically seniors, that have heart conditions and things like high blood pressure and things that increase their risk for heart disease, it's very important for you to talk to them and educate them so that they can protect themselves in this volatile period of time we're living in. Again, it's always important to keep things in perspective. COVID-19 to date, the coronavirus has in the U.S., I think we have about 1,100 cases currently, and there have been, the latest that I read this morning was about 31 deaths. So the rate of mortality is about 3.4% so far, but that mortality rate, the number of people that die from it, gets higher as you go in the elderly population. Every decade of age increases that. And then specifically, if that individual has things like respiratory disease like asthma, COPD, allergies, or any type of heart disease, any type of stents in the heart, any type of pacemakers, these things, the risk for those people are much higher if they get the disease. So we have to protect ourselves and be aware of our conditions and our families, friends, colleagues, whoever we know. Also, people that have diabetes have a higher and a more severe case of respiratory infections, and they get the clinical sequelae a little more severe than others would, than general healthy individuals would. So that's what's going on right now. An interesting fact that I read about this morning was that the country of South Korea and the U.S., specifically, we had our first case and they had their first case of coronavirus on the same day. So South Korea is a country that's much smaller than the U.S. Our population is about 6 to 7 times more than South Korea. And to date, if you look at the numbers, the South Korean government and their medical system has done over 200,000 tests. And this is just kind of an illustration of what's going on and how unfortunately behind our medical system is on this emergency and on this COVID-19 situation. To date, the U.S. has tested less than 5,000. So this is a big factor and a big delay in treatment as well as in containment of this issue of the COVID-19. We look at a country like South Korea, they've already done 200,000 tests, and here we are, we're just shy of 5,000. So this is something that has to get fixed, and now I think the CDC has agreed with a couple of private companies, you guys might know them, LabCorp and Quest, and they're taking to testing these for the COVID-19 virus. And hopefully, the number of tests are going to be increasing, and there'll be more available to the hospitals and the health agencies. So this is something that is of concern, and I would encourage you to reach out to your local government representative and let it be known that this is unacceptable. We're all, taxpayers. We live and share here, and this is a public safety concern. And it is very important that this is tested and treated and taken care of in a very nice fashion. And that's something that was just kind of shocking to me. Hopefully, we will get through this, but we need more testing, and we need to not overwhelm our medical system. So we need that testing early, so we know how to cope with the patients. So that was my little gripe on that. I was shocked to hear that. So getting back to COVID-19, again, the ways you want to protect yourself, number one is hygiene, washing your hands for a period of 20 seconds or more under warm water with soap. Number two, avoiding people that are coughing and sneezing, and anywhere there's big crowds of people, you want to avoid that. You want to contain yourself from that. And then also, number three, you want to sort of practice social distancing. A lot of the universities in the local area, UC Irvine, USC, Pepperdine, a lot of the schools now have opted for online classes. They've told their student population not to come on campus. A lot of the high schools in different areas that had suspected people with possible coronavirus interactions, they've closed their high schools. So it's very important for us to practice that social distancing so that we don't all get the virus, and we protect ourselves and our friends and our families and our offsprings and our grandparents and fathers and mothers and uncles and whoever we have. Specifically the elderly, it's very important that we protect the elderly and not expose them unnecessarily to environments where it could be detrimental to them, where they can catch this virus. It's very important to keep that in mind, and if it's not an essential place that you need to go, don't go. We can't emphasize that enough. It's very important. As we look at Italy, the whole country has come to a standstill, basically. All the northern areas, they've done optional and voluntary containment, and they're doing social distancing, and they're people that have it are in isolation, they're quarantined, and we get a lot of insight from people in the medical community there of what to do, because we don't want to overwhelm our medical system here, specifically because we don't have a national health system. So the coordination in the U.S. is a little bit needing of more improvement and enhancement. We have a lot of different hospital systems which are privately owned, and then we have government hospitals, and then we have the CDC. So first they give them to the government hospitals, then they go to the private hospitals. So there's a little bit of an organizational delay, and it is a challenge, and hopefully the Health and Human Secretary and everyone else assigned to this job can do a great job and get it done, and make sure that everyone is safe and tested and sound. Getting to the topic of heart disease, heart disease is very, very common in the U.S. It's one of the number one killers of men and women, and it exists without having this exacerbation or having an infection like COVID-19 on top of it. So heart disease, there's different categories, but there are some facts that and some risk factors that we need to know about. And if we fall into these categories, we need to be extra careful so that we don't get contaminated or infected with the COVID-19 virus. Some facts for you guys. 1 million people usually in the U.S. yearly have heart attacks, which are myocardial infarctions. So the general heart attack. So it's common. And there's about 16.5 million people above the age of 20 who live with coronary artery disease, meaning that they have some level of blockage in their coronary arteries in their heart. So 16.5 million people above the age of 20. So that's something to think about, and there are people walking around with heart disease that don't know it. So it's very important to get tested and seen by your doctor, so that you make sure that you're not someone that's walking around with silent heart disease and you don't know about it. Typically, in a year in the U.S., there's just about 795,000 people that get a stroke, and we have about 356,000 cardiac arrests outside of a hospital. So that's 350,000 people that have cardiac arrest outside a hospital. We have currently about 23 million people living with diabetes in the U.S., and this is also, something which affects the cardiovascular system severely. And then we have about 15% of adults in the U.S. Who smoke or who use cigarettes. So that's a high factor, and that's a high risk factor. So if you're smoking and living in this environment, you have to be extra cautious that you don't get this infections, and you have to be extra vigilant. It's very important. And then also the other factor is obesity. 38% of the adults as of 2018 in the U.S. are obese. 38 to 40%. So these are all factors that affect the heart, and from different things, from heart failure, pericarditis, which is inflammation around the heart, cardiomyopathy, which is the muscle of the heart getting issues, then valve disease, heart valve disease. These things all contribute to these types of issues. And then some people have arrhythmias, where the electrical system of the heart is not functioning properly, so the beating and the coordination of the muscles to pump out the blood is altered. And then we also have the peripheral vascular disease, meaning that the arteries and that are in the periphery, meaning in the hands and legs and brain and things away from the heart, away from the central area, they're clogged, or they have issues, and we're not getting 100% sufficient blood circulation in those areas. And then of course you have coronary heart disease, which is the coronaries, the vessels right around the heart themselves. They have blockage, and then they have aortic disease as well, which is the big vessel behind the heart, in the heart, that goes to the heart. That has issues as well. And then these things are all different types of heart disease that we need to be aware of, and we need to make sure that we get ourselves in our yearly checkup to make sure that if necessary the doctor does the EKG on us, checks the electrical impulses of our heart to make sure it's normal, and then the blood flow. And then maybe you'll need a stress test. Well, they'll put you on a treadmill, and they'll look at your heart at the same time and see how you handle stress. Things to look for yourself in your daily living. People that have discomfort regularly in the middle of their back, the left side of their hand, left side of their neck, you get a lot of stiffness. You get, that's more common in men, that they'll get that stiffness and the left side aching and pain. And then also, of course, the obvious is the chest pain. Some people might describe, they feel like an elephant is stepping on the center of their chest. This is a common description of it. These are all related to your heart. And then, of course, shortness of breath, meaning that you're not getting enough oxygen into your lungs. These are all symptoms, these are all signs to watch for. Specifically in females, sudden dizziness, you get a heartburn-like feeling, cold sweats, unusual fatigue, if you're always tired, nausea and vomiting. If you get these things, you need to go get checked out, and it's very important to keep this in mind and get seen by a professional to make sure that you don't have any type of heart disease. Our doctors, your primary care might prescribe some for cholesterol. There's a lot of people with high lipids in their body, and they're not taking any medications, or they're taking herbs. But it's important to take care of yourself and take those medications so that your body is functional in an optimal way. It's very important to do that. These are basic things for heart disease that you have to look for. And the other thing that a lot of the middle-aged people do is it's called calcium scoring. It's about a $250 test that people do, and that actually gives an indication of the blockage of the coronary arteries. It gives you a probability score, and you can get it done. You can request it from your doctor, and there's different cardiology offices that do that for you. So if you want to be proactive and do something, you can do a calcium scoring test on your heart and on your arteries, so that you actually find out beforehand and not be surprised later if there is blockage in your coronary arteries. So these things are very important in overall health. Heart health is very important, as it's a central engine for your body, and it does dictate and indicate other issues as well. So it's very important to keep that in mind, and in the future we'll try to cover different types of heart disease specifically, with exactly what to expect in the doctor's office and then in your cardiologist's office to get these things done. But awareness is very important. You have to be aware, and you have to get treatment and get diagnosed. And if you do have any of these symptoms, don't just pass it off and think it'll pass. You need to get it assessed. Make sure. It's better to know than not to know. If you know earlier, the earlier you know, the more intervention can be taken, and you will live a more healthier and better quality of life. So that's very important. These are the things that I wanted to share about heart disease. Again, we're in a state, or in a situation where everyone's kind of waiting to see what happens. But as far as the COVID-19 and coronavirus, you will see more cases being diagnosed because more testing is happening. So you'll see the numbers go up, and you'll see it. It might double, it might triple. Don't panic. Keep yourself safe. Eat well. Still do your exercise. But do isolate yourself, and don't go to major crowds. Social isolation is the key now, because we don't want to overwhelm our medical system or our hospitals, where patients that need to be seen and that need to be treated, they need to get there and do that. But we don't want a lot of people to go just with no symptoms and overwhelm the ERs. So it's very important to take care of yourselves and eat well, sleep well, and also make sure that essential travel is, if it's a must, you travel. But if it's not a must, stay home. Especially for our seniors, the best thing you can do is keep healthy, stay home, isolate yourself for a little bit, and just take it easy. You don't have to watch too much news, because the news is also very stressful on the mind for some people. So it's very important to keep that in mind. I hope that we've covered a little bit and helped you a little bit manage the what's going on today, and then hopefully we'll be in touch. If you have any calls or any requests, you can always reach us at the studio, or you can email us, and we'll be with you, and we'll help you and guide you through different things and get you the right care that you need. Thank you very much, and I think that is all we have for today.
My name is Dr. Yama Azar. I am the managing partner here at Genesis Medical Center. Genesis Medical Center is a comprehensive clinic where we provide wellness and preventative medicine to our clients. Mainly, we are in the business of providing stem cell therapies, PRP therapy, IV vitamin therapy, hormone replacement therapy. We treat conditions such as joint disease, autoimmune diseases, neurocognitive diseases. We are one of the only clinics that specialize in these things specifically. We don't do it as a side. The main difference that we offer to our clients is that we plan and make it our intention to educate our clients before they make decisions on treatment. We have time to spend with our patients, and I think that increases the quality of care as well as the quality of compliance.